Composite and porcelain veneers are where material is put on the front of the tooth to disguise what the tooth looks like underneath, and it can solve problems like crowding and discoloured teeth, and also just generally improve the appearance and width of your smile. Hi, my name is Benedict Harrison and I'm a dentist in London. Today I'm going to talk to you about composite and porcelain veneers. Composite and porcelain veneers are where material is put on the front of the tooth to disguise what the tooth looks like underneath, and it can solve problems like crowding and discoloured teeth, and also just generally improve the appearance and width of your smile. The difference between composite and porcelain are that composite is added directly to the tooth, so you still retain your tooth underneath. Porcelain veneers, normally we need to prepare a little bit of the tooth, so we just need to smooth the tooth down a little bit before a porcelain laboratory made veneer is placed on the top. This generally will last a little bit longer and will look nicer for a longer period. But there are both treatment options which are available here at this practice. The way that we would decide on what's best for you is by you coming in to see us for an examination. We would take relevant photographs, x-rays, and do a clinical exam. And then we'd be able to talk to you about what the different options are and what may be best for you moving forward. Normally, the treatment requires between 2 or 3 visits. So the first visit, we would take the records, so we would take a scan of your mouth. We would send that scan to a technician to prepare like a wax up. This is where you put wax on the front surface of a model of the teeth, so we can kind of plan the nice shapes that we want. We then have a kind of a trial smile appointment where you'd come in and we put the veneers in your mouth with a temporary material that we remove before you leave that day, and that gives us a snapshot into what this treatment will look like in your mouth, and it allows us to make any tweaks that we need to if you want your teeth longer or wider, or you're not happy with the shape of the teeth, or if you're not happy with the treatment at all and you don't want to proceed. All of these can be managed within that kind of trial smile appointment. The final appointment would be to do the treatment, and that would be to provide to fit the veneers onto the teeth, or prepare the veneers in the case of porcelain.